Hello and welcome and congratulations on your beautiful baby. We are so glad to hear that the pediatric surgeon has referred you for some conservative overview of what's happening. And what I'm going to do today is I'm going to talk you through a little bit about what chiropractic can do to help latching and attachment and potential tongue tie issues with your child. And then we're going to walk through the 4 phases of tongue tie so we can work out exactly where you're at with how the baby's growth and development of the nervous system is working, and then what we can do to help fix that. So I'm just going to start off by explaining a little bit about the phases of tongue tie and what we're looking for from a holistic perspective. You see, the mechanics of feeding and attachment start with the soft tissue of the tongue. And a phase 1 tongue tie is when the soft tissue hasn't formed properly or it's attached and stuck in different ways. And so that's a fairly straightforward issue, because what we can do is we can sweep and move, and at worst we can cut that tissue to release that. And then what we need to look at further is the structures around the mouth, because it's not just about the tongue, it's about the movement of the jaw, but more importantly is that there is enough room in the roof of the mouth for the tongue to sweep through. So I'm just going to use this model to explain. This is an adult skull, however I will show you a pediatric skull in a little while. Then in the proper mechanics of swallowing, 2/3 of the tongue sits inside the ramus, or this round part of the jaw, and only 1/3 is what we see. And so when the tongue is not moving, it's not just about the little bit at the top or the little bit of skin or tether that's happening in what we can see. It's about what's underneath and around the base of the jaw. So we can get our hand in here and we can release that and move that, or we can squeeze and stretch the tongue to help that muscle move better. But what happens is the muscles in the nose and face are supplied by the brain. The electrical messages which tell it what to do are a neurological function. And so the brain sits inside the vault here, and inside the roof of the mouth there is this bone called the sphenoid bone. And the sphenoid bone, if it falls forward, will decrease the size of the roof of the mouth. And that means that as the tongue sweeps through, it hits a wall. And we call that a flexion in the palate. So if I take these parts of the skull off, you'll see the sphenoid is this little angel that lives inside your head. And it very importantly holds up the big part of the brain here. And so when there is distortion in the skull or flattening of the head or plagiocephaly, the natural fall zone or crush zone is in the roof of the mouth. And it's very common these days to see children with a flexion in the palate. It will affect the temples, which is also where the jaw attaches, and so it doesn't let them open and close their jaw well. But more importantly, it causes a drop in the eye sockets because it forms the back of the eye sockets. It also houses the nerve and blood supply to the eyes. And so when the sphenoid falls down, it will feel like a piece of wood or a flexion in the back of the roof of the mouth. And the tongue and the gag reflex are too far forward. So one of the important things to all of us to look at before we start cutting a child's tongue is to make sure that the bones in the roof of the mouth are where they belong, because that enables the tongue to sweep all the way through. It stops the gag reflex coming too far forward and the baby spitting and throwing up too much, and it makes sure that this little angel inside your head can pump as we swallow and breathe and help pump the spinal fluid, which helps the brain develop and make sure that our child's neural functions are all happening as best as possible. When that's lifted up well, the eyes are clear and open and they're not converging and they're not having any troubles with their tracking. That's one of the ways we can see the soft neurological sign of really good cranial motion. So a chiropractor will look, what I'm going to look for today is I'm going to make sure that the sphenoid bone is sitting up. I'm going to make sure all the soft tissue in here has grown and developed properly. You see, the spinal cord when it's forming is a clump of cells, and then it forms a tube. The neural tube develops through a cleft in that clump of cells. And that tube, if it doesn't glue together over the top, doesn't allow the brain to glue together. And it's why we see so many women in pregnancy is we want to make sure that the nervous system is developing and growing well to enable the baby to grow well. So we are going to check today whether the phase 1 tongue tie, which would be just the soft tissue issue, or there's a phase 2 tongue tie that is to do with the cranial bones and the nervous system in the back, that the messages are getting through from the brain to the tongue to coordinate its functions properly. And then we're going to check for phase 3 or phase 4. So I'm going to talk a little bit about your history and whether there is problems with the glue system in the body and the healthy function of the nervous system and the methylation, which is how your body takes food and turns it into brain and muscle and nerve tissue. So it's really important that we understand the background. How depleted the mother is, or the father, or the grandparents will tell us whether there is a chronic depletion in the nervous system. So that then will determine how much treatment is going to be required. Because the child, we can release the tongue if it's a simple soft tissue issue. And then we've got to release the cranials, which are a bit more complex because you can't pop and shift cranials very easily. You've got to glide them and slide them. And that's going to take 4 to 6 adjustments just to get the good cranial motion and release all that tissue. And then if there is neurochemistry that's been donated or come down from generations, we've got to feed the baby and feed the mother with good wholesome methylation improvement to make sure that there is good wholesome nutrition and neurochemistry to make the nerve system and the brain tissue grow stronger and grow more resilient, which can still happen even after birth. Ideally, it happens in pregnancy, but we're picking these things up now so we can put in some struts that we can rely on for the brain and the nervous system to grow really thoroughly and really healthy. So if you're ready, we'll get started and we'll do an examination. At the end of that, I'm going to give you an idea of whether I think it's phase 1, 2, 3, or 4, and that will dictate just how long we're going to be needing to do care for. The goal, the first goal, is to make sure that we have the baby attaching and latching as best as possible. And even if there is a phase 3 or phase 4 issue, what we're going to do is we're going to put some steps in place, but we're going to get some improvements. Every time you have an adjustment, it's going to improve the neural function, and we'll see signs of improvement, and that's part of where you'll get the confidence to know that you're in the right place and we're doing the right thing to build back better a nervous system that might have some deficiencies. And that's just what happens in life. Sometimes we don't know these things, and now that we do, we'll be able to naturally and conservatively build back what's missing.